We have now Erich Tauber by uns. Erich is CEO and founder of the Vienna-based company Themis Bioscience. It is a leading company in the development of vaccines against immune diseases. Themis was bought by Merck in 2020. Themis technology has been developed at the Institut Pasteur in Paris. Erich, very welcome to the conference.
Hello, thank you for inviting me, and thank you for the kind introduction words. And as you have mentioned already, we are a biotech company and we are around for a bit more than 10 years now. I have been trained as a pediatrician, so I was working in the medical field and was working in the pharma and biotech arena before. So I was part of Intercell during the time of Intercell's IPO 15 years ago, and started my own company then in 2009. And as you can now see, time has changed radically. Like 12 years ago, we have founded a company more or less on the vision that the world would need technologies to develop vaccines to fight epidemics or pandemics. And we have looked around and identified a piece of technology, and we have acquired this technology from the Institut Pasteur in Paris. And this is a measles vector, a virus vector based on the measles vaccine. And what we can do is we can modify the measles vaccine to bring RNA into people. Or in other words, we can vaccinate against chikungunya, against COVID, against cancer using a modified measles vaccine. And this is how it started more than 10 years ago. And in the meanwhile, we have built a portfolio on a number of vaccines like chikungunya, which was a quite important disease in the tropical areas and is still an important disease. There are many outbreaks in the Indian Ocean, also in the Caribbean. We have, of course, started also to develop vaccines against Zika, against Lassa fever, against MERS, but we're also doing vaccines against other infectious diseases like RSV, CMV, Noro, and we are working on a number of undisclosed targets together with our now owners, Merck or MSD, how they are called outside the USA and Canada. And we also have started to work in the cancer field. As we have started the company, we had many questions as a founder, and maybe also the big question was, should we found a company or should we not found a company? Being an employee is a nice thing sometimes because somebody takes care of you, somebody takes care of the salary and sends you on vacation. But there are also some disadvantages, like you have maybe more freedom if you're an entrepreneur, but maybe not. So the decision was made to found the company, and it took us quite some time to close the first venture capital round. And venture capital are maybe one important animal you need to learn to know or to love or to hate if you're a founder. We have so far managed to close 4 venture capital rounds in the last 10 years. And I believe there was not a single year where we did not close an extension or an add-on or something to this venture capital round. But we have also raised the same amount of non-dilutive funding, which would be Horizon 2020 money, which could be funding by CEPI, which is a non-profit organization to fight pandemic threats, or other non-profit organizations or NGOs. But what was quite important was the first clinical proof of concept of our chikungunya vaccine, which was like 5 years ago. And this really allowed us to upscale the company. At that time, an organization called CEPI was born. CEPI had the mission to prepare and to develop vaccines for diseases which were more or less unknown to that time point. And they had the brave mission that at some time there will be an outbreak of a disease. They call it disease X, and people need to develop vaccines faster. So we have been the first company to sign a contract with CEPI, which was allowing us to further develop our technologies. And there are other companies, many of the companies we have all read in the newspapers of companies who brought COVID vaccines to development or to market. We're also part of CEPI agreements later on. In the 10 years, we have learned from the capital markets that vaccines are maybe not so interesting for that, and everybody suggested to us that it's much better for us to develop cancer vaccines. So 2020 was an interesting year for us because we have started at the same time point, more or less, or 2019. We decided to start cancer vaccines, and then the world changed, of course, because COVID was there. We have, of course, also developed the COVID vaccine early in 2020. A few months before that, we have signed a partnership agreement with MSD, or the Merck as they are called in the US. And MSD and we have worked on a collaboration for approximately half a year until it was apparent to Merck that they need to do something in the COVID space. For us, we had many questions. We were back in April 2020. We are still a much smaller company than Moderna or BioNTech was last year. We were roughly 35 people. We have raised only 75 million in capital. We had the means to develop a vaccine, but we didn't have all the means like going to manufacturing and so on. So one possibility we had in mind was to stay as an independent company, to go public. We have prepared for a Nasdaq IPO, but at the same time we have of course talked to MSD, and then in May we have been acquired by MSD, and since then we are part of MSD. The vision is that we are working now as an independent entity within MSD to further create vaccines on for pandemic preparedness. Lucas has asked me to think about potential founders who are in academia, and these would be my 5 or 6 major key takeaways when I look back and what I have done right and wrong in the last 12 years. So maybe the first recommendation for new founders or wannabe founders would be talk to people and talk to many people. At least I have done this. I've talked to all people which I knew or have not known, especially in my environment. Vienna has been a quite active environment in biotech development. There was Intercell, which was kind of pioneering the field and have, together with many others, but maybe they have been regarded as a very successful example of going IPO, are still in another form active. So helping, I believe it was most helpful for me to talk to people who have been successful and have not been successful. There's lots of readings available, and you can, of course, also take an MBA in entrepreneurship and whatsoever, and you can read many books. What I found most inspiring was the author and entrepreneur Guy Kawasaki. So this is really fun, and this is quite helpful for young entrepreneurs. What's also important is there's a rich environment, especially in Austria, on funding, on seed financing, on incubators. We have been part of INITS as we were founded. We have been privileged to get funding from FFG and AWS in Austria, which are a very nice basis for the first years. What maybe is difficult in Austria is that we don't have the same investors as other countries have, venture capital investors, especially not in the biotech field. So at some time point, then it's better to take it sooner than later. Biotech founders in Austria need to be much more international than maybe in other fields. All the venture capital we have received with very small exemptions are from abroad. Take it serious, and I've also seen this in a networking presentation from Dr. Erich. Being an entrepreneur is not like a part-time job. I don't think you can enjoy being a professor at the university and moonlight as an entrepreneur or be an entrepreneur on the weekends. I think it needs much more blood, sweat, and tears, and you need to really focus on this to be successful. And maybe the last one would be think big in all dimensions. So if I would be very critical about what we could have done better, when we were at the end only 35 employees, we have raised 75 million. If you compare it to companies like Moderna or BioNTech, you talk about completely other dimensions. So I think we could have tried to make it bigger 10 years ago, but maybe we have not been able to make it bigger. So that's my presentation. I'm looking for a fruitful discussion after the third keynote. Thank you.
Well, thank you, Erich, for your insights and learnings. And one question from my side, which interests me a lot, when Merck bought your company, was this actually for you with one laughing and one weeping eye, or how did you feel? Because I guess that Themis was also your baby.
I think being a Themis founder for the last 12 years was very much, and this is not only a saying, but it's really a roller coasting ride. I mean, we have made financings every year in 12 years, which means we were short of being bankrupt every year. So being in the position to secure funding for the company and being in a position to really allow the company and the technology grow, like being part of MSD, is definitely a very nice opportunity. And the other opportunity of going public, raise money on the financial markets are, of course, also a nice thing, but I think there was nobody who at the time point felt bad about the acquisition.
Thanks a lot, Erich.